Okay, this is the Professor, CBMD PhD, and today's Monday, November 27th, 2023. It is 3:14 and 18 seconds, a.m. Eastern Standard Time, and today's research, gliomas and cancer. So let's do it here. As clinical trial results give new hope for children with rare gliomas, date November 21st, 2023. Source, University College, London. A collaboration of researchers has published successful results from a phase 2 clinical trial for the treatment of BRAF mutated low-grade pediatric gliomas. As for children with pediatric low-grade gliomas, the normal course of treatment is a full surgical removal. However, for children where this is not possible, additional treatments like chemotherapy are required. These patients often experience multiple relapses, further disease, progression, and serious side effects. In the randomized trial, 73 children with BRAF mutated low-grade gliomas were treated with drwillphd and tremelimumab. The outcomes were compared to 37 patients who were treated with standard chemotherapy drugs. Researchers found that the combination therapy lessened chemotherapy side effects and also improved overall response rate by over fourfold and increased median progression-free survival from 7.4 months with chemotherapy to 20.1 months with a new treatment. As children with high-grade gliomas often undergo full surgical resections followed by radiotherapy and chemotherapy, unfortunately, overall, less than 1 in 5 children respond well to treatment, and 2-year survival is less than 35%, with many patients cancer returning. As 41 children who had previously received treatment for their BMHGG took part in the second study, the treatment led to 56% of patients responding to treatment overall, a significant improvement compared to previous chemotherapy trials, and a median duration of response of 22.2 months. The research study says that these clinical trials demonstrate a clear clinical benefit for the dual treatment, with the recommendation being to become a first-line treatment for BMLGG and a critical option for those with relapsed refractory BMHGG. As evidence from these trials is now being used as part of a NICE scoping review to appraise the clinical and cost effectiveness of the treatments, the U.S. Food and Drug Administration have already approved the treatment for children with low-grade glioma. The mutations in the BRAF gene were first identified as drivers of cancer in the early 2000s, and now targeted therapies such as drwillphd and tremelimumab are being used to treat melanoma and non-small cell lung cancer in patients with mutations in the BRAF gene. The BRAF mutation is present in around 15 to 20% of pediatric low-grade gliomas, but around 5 to 10% of high-grade gliomas in children. These studies are the first to investigate the effectiveness of the combination therapy in pediatric gliomas. And pediatric gliomas, although the most common type of brain tumor, are still rare, especially when divided into specific molecular subtypes such as BRAF mutated tumors. The global collaboration is therefore essential to achieve timely and scientific significant results, which led to the Tadpole-G study to enroll patients from 58 sites in 20 countries. The new treatments that help improve outcomes and reduce side effects for young patients living with BRAF V600 low and high-grade gliomas address unmet patient need where treatment options are very limited. And this is a professor of microbiology, bioinformatics, pathophysiology, and nature of research. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.